The days of the independent Republic of Pharmac are over. That's what the Health Minister Andrew Little said today in response to an independent review of the drug funding agency. Review panel chair Sue Chetwin said it highlighted deficiencies in the decision-making process and the quality of the decisions. These resulted in inequitable outcomes for Maori, Pacifica and disabled people. Little says he still has confidence in Pharmac's leadership, but the agency needs to engage more with other parts of the health system and the public, particularly Maori. Isabel Ewing has more.
Wiki Mulholland was diagnosed with cancer in 2018, the start of a fight by her and husband Malcolm to overhaul Pharmac.
She's no longer with us, and there have also been a number of patients and their families that did participate in the review, and they're also no longer with us.
The independent review of the drug agency released today found failures in its decision-making and in its own performance obligations.
And the board of Pharmac have essentially been asleep at the wheel, and the management of Pharmac have been allowed to roam rogue. And the result of that is that lives are lost.
The treatment that might have prolonged Wiki Mulholland's life was not funded by Pharmac. Today's review revealing the drug agency has failed Maori like her, finding that Pharmac's analysis of Maori health needs and issues was particularly flimsy. There was a disconcerting absence of information on Maori health needs and inequities, and Pharmac's factors for consideration, which are need, health benefits, cost and suitability, came with good intentions but failed to achieve their purpose.
Its work is unfair, and its decisions work towards better health outcomes if you're not Maori.
Andrew Little says that'll be addressed by Pharmac working together with the Health Ministry and new entities Health NZ and the Maori Health Authority.
The days of the independent Republic of Pharmac are over. Pharmac is part of our health administration that needs to be working appropriately with the rest of the health administration.
The Health Minister promising Pharmac will listen to patients and their advocates when deciding which drugs are funded.
Getting the cheapest possible drugs isn't the only health strategy.
Opposition parties say the government's response to the review shows it's prioritising its multi-million-dollar health restructure over improving access to life-saving medicines.
Recommendations such as updating the medicine strategy is being put off until the therapeutics bill has concluded. That could take a long period of time.
As for the review panel's call for more transparency from Pharmac, not a good start today with a refusal for an interview. Instead, a one-line statement saying it looks forward to acting on the recommendations.
Well, Isabel Ewing joins us now live from Parliament. And Isabel, when can we expect these much-needed changes to come into effect?
Well, Sam, that's the question for those with loved ones in need of life-saving drugs and for those who have already lost loved ones. They've already had to wait another 4 months for the government to release this report. They've had it since February and are just responding today. Now, Health Minister Andrew Little says that those health restructure changes will take a couple of years to come into effect, but for those recommendations we saw for Pharmac today, they'll come sooner. The Health Minister saying that Pharmac will begin changing its attitudes and approaches almost immediately, which can't come soon enough for advocates. As Malcolm Mulholland told me today, for those with a terminal illness, time is a luxury and lives could have been saved by those attitudes changing much sooner.
Tēnā koe, Isabel.